Hello everyone, we are from Group 4, Class 4A. In this video, we want to explain about nutrition care process for HIV AIDS patient. But first, let me introduce our team. We are from Group 4. I am Feriska Saputri and my friend our Syafiroh Ulya, Agnes Hutabarat, Lawrence, and Kalani Bhagya. And this is our topic outline that we will discuss. There are pathophysiology, diet goals, diet requirements, case, screening, assessment, diagnosis, intervention, monitoring, and evaluation. Here is the process of HIV/AIDS. The first transmission process can be caused by homosexual, heterosexual, blood transfusion, or drug abuse, which attacks the lymph nodes, spleen, and bone marrow, thus infecting T cells, macrophages, and dendritic cells. Well, this HIV binds to CD4 peripheral proteins, then infects immune cells in our body, causing a lot of T cell deaths, which affects the host killer response. The decrease in the number of T cells makes our immune system weaken, so that the function of B cells and macrophages will reduce the function of helper cells or CD4. CD4 cells will die, and the HIV virus reproduces and infects other body cells, and making the body's immunity decrease. We choose high energy, high protein diet for HIV/AIDS patients, and the dieting goals are: first, meet the increased energy and protein needs to prevent and reduce damage to body tissues, and second, increase body weight to achieve normal nutritional status.
Dietary requirements. High energy is 40 to 45 kcal per kilogram. High protein is 2 to 2.5 gram per kilogram. Adequate fat, which is 10 to 25% of total energy needs. Adequate carbohydrates, namely the rest of the total energy, protein and fat. Adequate vitamins and minerals according to the recommended nutritional needs or RDA. Food is given in easily digestible form. For certain conditions, the diet can be given in stages according to metabolic condition or status. HIV/AIDS case. Mr. JJ is a private employee, 38 years old, height 175 cm, weight 55 kg, was admitted to the hospital with the main complaint is the patient had diarrhea accompanied by dread since 1 month before MRS. Weight has decreased by 20 kg during these 5 months. Since the last 2 weeks in his mouth there is candidiasis oris and body temperature has increased since 3 weeks before MRS. Patients often have sex with same sex. Family history. Mother suffers from DMN hypertension. Eating habits: 3 times soft foods, 3 cups of sweet tea per day, 1 to 2 pieces of white bread 3 times per day, 3 to 4 pieces of fresh fruit per day, grapes, apples, oranges and longan. Vegetable: 2 times per day, mustard greens, broccoli, spinach and carrots. The result of the 24-hour recall while in the hospital obtained energy 1109.2 kcal as a percentage 38.48, protein 21.1 gram as a percentage 11.76, fat 3.8 gram percentage 5.93, and carbohydrates 247.9 gram as a percentage 62.454. The patient has signs of temperature 39.1 centigrades, blood pressure 110 to 80 mmHg, pulse 82 times per min, RR 20 times per min, diarrhea plus, hemoglobin 8.7, albumin 3.3 grams per deciliter, SGOT 100 for IU per liter, SGPT 90 IU per liter, sodium 120 microequivalent per liter, potassium 3.1 microequivalent per liter, lymphocytes 17.2 percentage, hemocritic 30.2 percentages, CD4 49. Methods: anti-HIV rapid tests, all reactive physically, the patient looked thin and weak. Here we use nutrition screening form is must. Results: patient at high risk of malnutrition, individual nutrition care and daily monitoring, repeat screening every 7 days. Total overall score is 4. Assessment. This chart shows the fulfillment of food intake. It includes energy, protein, carbohydrates and fat intakes and needed and their percentages. History of food and diet. Patients diet 3 times a day, normal appetite, 3 times soft food, 3 cups of sweet tea per day, 1 to 2 slices of white bread 3 times per day, 3 to 4 pieces of fresh fruit per day, grapes, apples, oranges and longan, vegetables 2 times per day, mustard, broccoli, spinach and carrot.
Okay, next assessment weight 55 kilograms, height 175 centimeter, and ideal body weight 67.5 kilograms, and the result of BMI is 17.95 kilogram per square meter. Based on BMI, the patient has an underweight nutrition. Okay, next assessment biochemistry. We can see HB level and albumin level are low, SGOT level and SGPT level are high, and then natrium, kalium, lymphocyte, hematocrit, and the last CD4 are low. Okay, next assessment, physical clinical. Physically, the patient looked thin and weak. We can see blood pressure level is normal, temperature level is high, pulse and respiratory rate level are normal. Okay, next assessment, personal history. MRS complaints, the patient has had diarrhea accompanied by drag since 1 month of SMR. Body temperature has increased since 3 weeks to 39.10 Celsius. Candidiasis auris has been present in the patient mouth since 2 weeks ago. Disease history, diabetes positive and hypertension positive. Other, patients often have sex with same sex.
Okay, the next one is a nutritional diagnosis. For that, we diagnose with NI 2.1 is inadequate oral intake is related to a decreased ability to consume sufficient energy as characterized by a weight loss of 20 kg over 5 months. And next is NC 1.2 is chewing difficulty related to oral disease characterized by the presence of Candidiasis auris in the patient mouth. Next is NC 3.2 is unwanted weight loss related to with prolonged catabolic illness characterized by a diagnosis of HIV or AIDS fever since 3 weeks before hospital admission and less than 5% weight loss over 30 days. And last one is NB 2.5 is poor quality of life related to an unhealthy lifestyle characterized by promiscuous sex with the same gender. And the next steps is intervention. The purpose is increase the patient food intake gradually, give soft food to the patient, provide a TTP diet to increase energy intake and increase patient knowledge. The principal diet is high energy, high protein or TETP. The types of diet is TETP diet and form of food is soft food because the patient has candidiasis oris. Energy is calculated according to the Mifflin formula, taking into account basal, physical activity and stress factors. Energy is provided high to meet basal metabolic and activity requirement during illness. And the next steps is intervention plan for calculation of patient energy needs. And the ideal body weight formula we got the result is 67.54 kilograms. And for resting metabolic rate we use Mifflin formula and the result is 1583.75 kilocalories. And for total energy expenditure, the result is 2882.43 kilocalories. So for the total, we got the energy is 2882.53 kilocalories. For protein is 180.15 grams. And for fat is 64.5 grams, and for carbohydrate is 396.34 grams. For the next slide is menu planning for HIV or AIDS patient. For breakfast, we made porridge with salty squid and egg tofu soup, fruit and milk. With the ingredients is milk, white rice, squid, white mushroom, salads, garlic, onion, tomato, leek, galangal, lemongrass, bay leaf, margarine, salt, sugar, egg, tofu, sweet corn, carrot, celery, onion, salt, sugar, strawberry, and soya milk.
For snack 1, we made pancake with ingredients oats whole grain, low-fat milk, and ambon banana. For lunch, we made porridge with ingredients malt white rice, fish wrapped in a banana leaf with ingredients tilapia fish, salads, garlic, leek, tomato, bay leaf, basil leaf, candle nut, ginger, turmeric, fine coriander, salt, and sugar. For spinach soup, with ingredients quail egg, fresh spinach, carrot, sweet corn, salads, salt, and sugar. For fruit, we choose grape. Next. For dinner, we made porridge with ingredients malt white rice, salt clams with ingredients clams, garlic, salads, leek, galangal, bay leaf, soy sauce, salt, sugar, and ground pepper. For salt string beans, with ingredients string beans, tempeh, salads, garlic, and soy sauce. For drink, we choose squeezed orange juice. And for snack 3, we made soya milk and bread with ingredients wheat bread and soya milk. For this menu planning, we have total intake for energy is 2819.50. For protein is 163.1. For fat is 68.6. And for carbohydrate is 401.6. Next is monitoring and evaluation. First, intake eating indicator. We target daily diet, appetite, and eating habits are stable with implementation is every day. Second, anthropometric indicator. We target body weight up and nutritional status normal with implementation once a week. Third, biochemistry indicator. with target hemoglobin, albumin, and total protein is normal, with implementation is every day. Fourth, physical clinical indicator with target normal blood pressure and temperature with implementation is every day. The last is knowledge indicator with target increased knowledge related to the given diet with implementation is during counseling. Okay, we still in monitoring and evaluation. From these results, we can see that all parameters are close to the expected normal numbers. So, it needs to be continued until it reaches normal levels. That's all of our presentation on assessing standardized nutritional intake for HIV patients. Thank you so much. Bye.